Let it go. Good. Easy, let it go. Good. Let that drop for me. Good. Good morning, everybody. This is Dr. Warren here with Alex. Alex and I go way back. We're lacrosse teammates post-college.
Yeah.
What was the name of that team? It was through...
Freebird?
Yes.
Yeah.
And Brash invited me out to come play with them. Brash is a Towson University guy, so we go back in the lacrosse world. And my father, who's also a chiropractor here in Towson, is taking care of Alex right now. I'm stepping in while he's away on a well-deserved vacation. Tell me a little bit about what brought you in and really kind of your experience so far up to this point.
Yeah, a little sports injury. I ended up having what we believe is a herniated disc, and so some low back pain and sciatica going through the butt cheek and down the hamstring, and so done a lot of traction, done some adjustments. I've done some physical therapy, some McKenzie exercises. So really helped. The fact that I can bend over and pick up my kids now is a plus. So.
Yeah, so kind of a classic presentation, and a lot of people can relate to this as it relates to just pain traveling down the leg. When you bend over, when you put your shoes on, or when you straighten your leg and lean forward, you can kind of feel and trace that discomfort or pain all the way up into the back. A lot of times sitting aggravates it quite a bit. Even the pressure of your body on the leg tends to aggravate people's sciatic nerve, especially when they're in a flare-up like this. And so he's been coming in over the last month or two. Really the first month is calming down the storm, and then after that we're focusing on function of the tissue, as in getting it to move better and getting it to become more flexible. So lumbar spine decompression therapy is what he went on after his pain kind of settled down a little bit more. The McKenzie stretches are low back stretches that we do in the office, or it's a protocol for dealing with symptoms that radiate from a lot of different areas, whether it's from the neck, the low back, even we work on people's elbows, wrists, ankles. So it's a joint-based approach for dealing with pain. And the lumbar spine press-ups are something that you can check out on our channel. They're very, very helpful for people dealing with low back issues. Even just general stiffness, it's a great protocol to follow. So we've been using that, and these problems, especially when you aggravate the area, follow a specific timeline usually. It's about 1 to 2 months is kind of where most people sit. Sometimes people can get into 3 or 4 months of really intense treatment for that type of a problem, but Henny's here kind of on the following through on the latter portion of 2 months, and I think you're really kind of progressing to a point where he's becoming active again. We're not picking up lacrosse sticks as much as we used to anymore.
Yeah.
We wouldn't make it through our Monday day, and like Alex said, he's got little ones at home, so spending time with them and feeling good doing it is kind of our focus right now, and I'm on the same boat with him. So I'll show you how I adjust him and work on his lower back, and if you're dealing with this issue, I'm happy to help you out. Cool?
Awesome.
All right, so why don't you come on up and relax, and we'll catch up a little bit while I'm working on you. You can come face down to start. We'll get moving on your mid-back first. So our Towson University men's basketball team made it pretty far this year. When Alex and I would go, I mean, when did you graduate from university?
09 and 11.
Okay, so you're a couple years prior to me, and then I'd imagine the team wasn't as solid back then as it is now.
Right, we had Gary Neal back then.
Oh, that's a different story. He played for the
Spurs for a little bit.
For a long time. Yeah. I think he had a good tenure in the NBA. A little release here for me, Alex. Let it go. Good. So you had some quality players. It was more of a challenge for the guys back then when we would go watch the games.
Yeah.
There weren't a lot of people. We didn't have a brand new stadium like they do now. So I mean, I would love if Towson became a sports town with basketball and hopefully one day football. They've got a good stadium for it. But they're making the right efforts on the basketball side of things. They had a good run of it. I was hoping for an NCAA bid for March Madness, but we'll see how it goes from here.
Football a few years ago too, went to a national championship. So
let me see it bend to the left for me. What year was that?
Oh my God, I have to go back. Right. Shout out to Anthony Davis. That was probably Pistol Pete. You remember? That whole crew.
Shout out to Pistol Pete at Ty West. Yeah. Come on your side, face me. So Pistol Pete. I don't even know. I guess that was
he's down in Texas right now.
He's a cop.
Police officer in Texas.
Yeah, he's a wonderful guy. One of the biggest, brightest smiles that ever came over and played lacrosse with us. He was a two-sport athlete, and he just liked to post up and rip shots on extra man. What a good person. Easy, let it go. Good. Lay on your back for me. Roll to your hip and face that way. Take your time doing it. So the range of motion looks really good. The reason I kind of look at his lateral bending is sometimes when people have this issue, it limits them quite a bit to one side. Usually the side where there's that lateral disc irritation. And overall, he's moving, bending really nicely into that space. His back isn't guarding as much when I move him. So he's able to get adjusted on both sides, and he moves really easily now. Let that drop for me. Good. Come on your back. Nice. Yeah, Terrence West, he played with the Ravens.
Ravens for a little bit, yeah.
They had a good team. That was fun watching them. Leon Kennard.
Yeah.
He came over. I played ball with him in high school.
What's the dude? There's a safety. Played
at Steelers
for a while. Yeah. I can't remember his name now.
Oh, he was fun to watch
Yeah.
in college. He was a beast.
I want to say Jordan or something like that.
Don't remember. Go, relax here. Let that leg drop. Nice. You're moving really well. And so from a progression standpoint, usually we start strength-based training, loading on the bar, putting some weights in your hands, moving a little bit more, kind of stair-stepping back up. So that, like, the biggest thing with this is flexibility and then capacity to handle stress, right? When you're dealing with a lumbar disc issue, right? So we start with range of motion, we start with the McKenzie stretches, and then we progress into some core loading where you're doing some floor-based exercise, where you're supporting your back, but you're challenging your core, right? And pretty quickly for someone like you progress to body weight exercises with some lighter weights just to feel those muscles activate, to kind of get that form going again as it relates to supporting your back and having a neutral spine when you lift, and then start a lifting program where it's spaced out and you can recover from the sessions to build up some of that strength back there. So you're naturally an athletic person, so you should progress pretty quickly through that stuff. It's really maintaining for you that flexibility. So when you go do your workouts, prep and finish with the McKenzie stretches, they'll make all the difference in the world on your recovery, and you won't feel like your back's starting to tighten up through that type of routine, right? So
awesome.
Grateful to work with you.
Yeah,
Thanks for doing
sure.
the video. I
Absolutely.
appreciate it.
Sure.
Thanks for watching. If you need any help, give us a shout. Thanks.